Hi. Thank you for Singularity for the invitation, and thank you Ajeas for hosting this event. So my name is Pedro Gouveia. I'm a breast surgeon at Champalimaud Foundation, and I came here to share our research work at the breast unit. And so breast cancer is the most common cancer in women. According to the global count, 2.1 million new breast cancer cases per year, and 0.6 million of deaths every year. So it means that we have a lot of diagnoses. Nevertheless, treatments have evolved. And you can see at 10-year survival now exceeds 80%. So we have a lot of diagnoses, but these patients will live longer and will survive more. So it means also that patients will live with the consequence of the treatments, whether we are speaking about chemotherapy, surgery, hormone therapy. And so as patients will live longer, survivorship issues have become important. So we do not want that patients also to survive more, but we want patients to have better quality of life. And of course, if you are going to do breast surgery, that will have an impact on a patient. And nowadays, breast cancer conservative surgery, by opposing of mastectomy, combined with radiotherapy, is the gold standard in breast cancer treatment. So this project is about choices. This afternoon, at 4 o'clock, I saw a patient that she was going to be operated on another breast center for a mastectomy. By the end, I offer her not a mutilating surgery, but a breast-conserving surgery. At the end of the story, this patient could tell that she had done chemotherapy, she has went to surgery, and she went for radiotherapy. And at the end, she could look at the mirror and say, I had a breast cancer, I survived with a breast cancer, and I have beautiful breasts. So, and that can make an impact. Besides, she had a breast cancer and she has like a chronic disease. So this is about breast cancer design thinking, translational research, and this is the way that we want to expose patients to their disease. So we want to build models, real models, fusing images from radiological images like MRI or mammography and 3D scan surface, and build a complete model so patients can understand the disease, they can see their tumor, and they can see or predict the aesthetic result of a breast conservative surgery. So what do we do? So we use 3D surface scans, we surface them, we acquire MRIs, and then we fuse those images and get a real 3D model of the patient. So the patient can understand the disease, and we can offer her several options for surgery. So now we are going to see a video. This is a PT 2020 project for a prototype to predict the breast conservative surgery aesthetic results. So it's a consortium between Inestech and Advance. So you can see these are the breasts. So with machine learning, with the patients that were recruited during this clinical trial, the system is now able to detect automatically the frontiers of the nipple areola complex and the anatomic structures of the breast. As you can see, so we are going to improve this prototype, so we are at the middle of the project. Then we can annotate, as you can see, the lesion in the breast, in the MRI images. I could see that it took 20 seconds at the most. And then the prototype is able now to fuse images of MRI images and 3D surface scans, and you can actually see a real patient, a real tumor in its exact location. So we can then simulate the excision of the tumor along with the healthy tissue around, and we can discuss with patients where we're going to put a scar, an Eden scar, and so the patient could actually see how the breast will behave not only with the surgery, but also with the side effect of radiotherapy. So you can see now that we can show patients how the breast will look like after radiotherapy induced by fibrosis, and sometimes the breast will have a small lift, and then patients would like to decide if they want to correct it or not. So this is it. So actually we are building avatars, and we can play with them and show patients how the scars will look like. Because when a surgeon removes a gallbladder from the abdomen, all you can see is going to see 3 scars, 3 holes. But when you go with a patient and you get breast cancer surgery, that will have an impact, because that patient will live with the scars for a long time, and that could have an impact in their life, in their self-esteem, and the way she will live their life. And then this is a secondary outcome. So since we were able to build real 3D models of the breast from the patients, now we can use mixed reality, and that technology can help surgeons doing surgery, meaning the majority of breast cancer lesions are unpalpable. So we have to localize them before surgery with wire, Geiger metallic harpens, or with carbon, all invasive procedures. With these new technologies, they are cheap. We can actually export the 3D model through a mixed reality goggles, and the surgeon could be actually operating the patient, seeing the tumor in a virtual way and knowing the exact location of this tumor. And so we are speaking also about connected health and connected care. And why? Because, well, actually, for example, in the United States, only 7% of patients are treated in highly specialized breast centers. And the difference between being treated in a highly specialized breast center sometimes has an impact on survival, meaning that patients that are treated in specialized breast centers will have better survival. Sometimes you can actually find a 10% difference, which is very big. And so it's very hard to move patients from one side to the other. And so, you know, telemedicine has been a total failure. So patients do like to see their doctors, and doctors do like to feel in touch with their patients. With this technology, we can building real 3D models, and actually we can see the inside of the patient and make a better conversation. And so we can giving remote assistance and contribute to the patients for a better treatment proposal, whether you are speaking about chemotherapy or surgery. And so we can actually have hybrid health facilities with digital patients, and like an economy sharing model, patients that don't have the ability of the money to travel and go around and looking for a specialized breast center, they can have a second opinion on the treatment proposals. It's just like an airport hub. So in the future, clinics and hospitals, we also treat digital patients because data is moving around. And so just like an airport hub, so the plane arrives, it delivers the passengers won't leave the airport, the passengers will get into a new plane and go to their final destination. This means it's the same. So whether the patient, it is in the UK, United States, or in Africa, the patient can send to us a 3D surface scan and MRI. We fuse that model, the both models, and get one, and we'll be able to give a proposal treatment for surgery or remote radiotherapy planning, or a remote oncological follow-up. So many patients are mothers, they are workers, successful workers, and so sometimes having longer survivals, meaning that they will have to deal with disease a lot of time. And so we want that patients could have their time with their families, they can be even more successful at their jobs, and for that we just have to give them an option to be followed with a different way using technology. And this is one way, and I think the future is coming up pretty soon. So thank you, and you are all welcome at Champalimaud, at visitors, not as patients. And once again, thanks for the invitation. Thank you.